Good afternoon, everyone. Welcome back to my channel. This video for young dentists who want to learn some diagnose and identify the proper reason and diagnose treatment for as emergency case. This is a patient came in at emergencies. She was referred by her husband to come to our office, a first-time patient, and she came with a chip complaint that her lower left tooth, one of the molars, really sensitive, and it really uncomfortable with cold eyes, and it's really hurt into all the way to her brain, and especially in her lower jaw. And I took X-ray and a panoramic, also the Bywin, and you don't see anything wrong besides there's filling done, and X-ray look pretty typically a normal scenario. However, as you noted, there is some little bit irregular shape of the enamel with the restoration done on the X-ray. You don't see much of the abscess or any type of potential emergency situation when you look at the perio-apical X-ray. Here's the clinical the evaluation after I did the perio probing. I saw some deep pocket on the distal side of number 18. Also, I confirmed cold test, very sensitive on number 18 compared to 19 and 17. So I went ahead and tell her that I will do exploratory endodontist, open up and drain and see if there is a crack line. And obviously, when we opened it up, you saw there's a crack line on the distal marginal ridge of the canal, and it go all the way down to the distal canal. And so basically the tooth is hopeless, even though the X-ray doesn't show anything. As you can see, this X-ray show a little bit more clear. There is a fracture line from marginal ridge all the way down to the purple chamber and all the way to the root. This is the vertical fracture tooth. It cannot be saved, even though the X-ray cannot reveal any kind of infection or inflammation, because this is a fresh fracture. Patient just complained a couple of days ago and really hurt her when she drink cold water. And so that's why we had to take out the tooth. It's hopeless. We cannot save anymore. And again, you can see some kind of irregular irritation of the gingival. That's come from the initial inflammation response. And so anyway, sometime on the X-ray it can fool you. It's required you to do several steps to identify the situation, either from perio probing, from cold test, tapping test, all of that test. And in conjunction with that, when you have to also when you see the clinical fracture of the enamel, you also have 50-50 chance explain to a patient that the fracture could be above the pole chamber, can be above the root surface, or can be below. If it's below, it's too late to save. In this situation, we explain everything before we start the patient, and the patient, I show the mirror, the patient agreed that this tooth is cannot be saved, and we went ahead and take out the tooth. And again, thank you for watching, you guys. Hope you understand and learn something about X-ray and diagnosing. Thank you for watching. Subscribe to my channel, learn more about quick tip for the day at Young Dentist. Thank you. Bye bye, guys.